Hi, I'm Dr. Clay Williams. I'm a board-certified urologist at UT Health East Texas, here in Tyler, Texas, and I want to talk to you about the 5 things that you need to know about stress urinary incontinence. Stress incontinence is a little misleading. It's not some sort of mental or physical stress, but it's a stress on the bladder, so that when you cough or sneeze or laugh or some sort of physical activity, you're placing some sort of pressure on the bladder. And it happens to be more common in women than men. With men, it's usually because a man has had a radical prostatectomy. He's had his prostate removed from cancer. That's 99% of the time. Women, we see it mainly after having children at some time in their lives. What happens is, with the physical coughing or the pressure on the midsection, you place stress on the bladder, and without tight muscles around the urinary muscles and sphincter that help you not leak urine, the bladder squeezes and then urine comes out with all of these physical activities. As a urologist, when we do a pelvic examination in our office, basically we're going to fill your bladder up with a catheter or a scope. And once your bladder is filled, we're going to have you simply cough and bear down. And when we see urine leak out, we pretty much confirmed your own diagnosis that you came in with a complaint of. And so the first line therapy, sorry, but it's not medications, is that we have the option of taking you to the operator room to place a little piece of sling or a mesh. It's a polypropylene mesh that only takes about 20 minutes, maybe 40 minutes to place in the operating room as an outpatient through a very small incision. And what Essential does is it doesn't lift the bladder, because that's a misconception, but the sling goes up and lifts the urethra, the urinary channel, so that instead of coughing and you leak urine, it's working like a little bit of a hammock, just to slightly lift that up so that you don't leak urine. In men, there's a similar sling. It's done for a little bit different reasons. Usually, again, after you had your prostate removed, and the mesh is a little bit longer, but it's kind of the same idea. If those procedures do not work completely, or maybe if you're elderly and you're not a good candidate for surgery, we do have a clinic procedure that we can do, but it's going into the urinary tract and placing some sort of bulking agent that's very safe, and it goes through the inner walls of the urinary channel to kind of squeeze together. You think about bringing pillows together to gently close off the urethra.